All right, this will be the lecture for the nervous system PowerPoint. This is in addition to what is in your book, just to emphasize some of the diagnostic testing we can use and also a couple of different conditions. So as you guys know, the nervous system has all the nervous tissue for the entire body, and it has two parts: the central nervous system, which is going to be your brain and spinal cord, and then the peripheral nervous system, which is everything outside of the spinal cord. So the central nervous system, as I said, brain and spinal cord, that's what does all your processing, your movement, how you coordinate your senses, anything that's higher function, that's all happening in your brain, right? Intelligence, memory, learning, emotion, and all of that. In the peripheral nervous system, that's going to be your motor and sensory nerves that go to your muscles, skin, everything like that. And they give information back to the brain. And then they also carry out commands from the brain. So they communicate, it's like a two-way street coming from there. So the brain sends them a message, and then they'll send back a message to let the brain know what's going on. So we're going to look at 3 different ways to check nerve function. Dermatomes, which is a skin sensation test, myotomes, which is muscle strength, and then deep tendon reflexes, which are often called DTRs, and that's a stretch reflex. So let's start with the dermatomes. We've got our man here that's showing pretty much all of them that you'll be able to see, and we'll break them down individually. But basically a dermatome is a part of the skin that's innervated by a specific nerve. So if you have someone who has a nerve injury, they might say, oh, I'm having numbness in my arm. Well, I want to know where in their arm they're having it, because as you can see on this picture and what we'll go over, there's a lot of different levels that are represented in the arm. So if you can figure out which level is bothering them, it helps you to kind of isolate what's going on with them. So we'll start with the upper extremity. So C5 is kind of the lateral part of the upper arm here, just kind of up by the shoulder is usually where I would test it. And by the way, if some of you have played with those little pointy, pokey pinwheel things, that is how we test with this. We take the pinwheel and we run it down one arm and then the opposite arm, and we tell them to compare how sharp that feels to them. Okay, so we've got the upper arm, C6 goes down the lateral side of the forearm and into the thumb and first finger. So if you kind of put your fingers together like you're making a 6 or an OK sign, that's how I remember that that's the side that 6 is on. C7 is the middle finger and right in the middle of the forearm. C8 is going to be your ring finger and pinky finger and also the medial aspect of the forearm. And then T1 will be in the elbow and upper arm. So it kind of goes around, starting from the lateral side, circles around back up the medial side. Okay, so you do want to know those. For the leg, we do L2 through S1. So L2 kind of comes across the upper thigh, middle of the thigh. L3 across the knee, that's how I remember that one. So it goes right across the lower leg, lower thigh and knee. L4, we say L4 to the floor. So L4 goes on the medial side of the leg all the way down to the big toe. L5 is kind of the center. So it starts on the lateral side. You can see over here, it starts on the lateral side, goes straight down, top of the foot, so middle 3 toes. And then S1 is going to be the lateral side of the foot and all the way down to the toe there. So again, you got 2, 3, 4, 5, 1. Okay, different ways we can check sensation. You can do superficial touch with something like a Q-tip. If you take one of those Q-tips and you sort of fray out the end, so it's just little wispy fibers, you can use that and have the person close their eyes and say, okay, tell me when you feel something. You can also use pain. You're not trying to really hurt the person, but you can use a little pin or the pinwheel that we do. It's just sort of a poking sensation. It shouldn't be painful, but you just want to kind of check if they can feel it. Deep pressure you would do just by squeezing. And then temperature, you can also do. Some people, these are different pathways in the brain, different tracks in the brain, but some people will have difficulty sensing temperature. So you could put an ice cube on them and it wouldn't feel cold to them, or you could put something really hot and they wouldn't feel that. Obviously that's an issue because there can be injuries that happen in that sense. Vibration's another sense, so you probably notice we have some tuning forks in there, and you can test vibration sense in those neurologic pathways if you like. A positional sense, basically I'm going to move your toe and ask you which direction I moved it. Obviously your eyes would be closed, but that's just that kinesthesia, knowing which way your joints are moving. Okay, so again, the pinwheel, you've seen it. Here's a little drawing of it. What you're going to do is hold it, and I'll show you when we do the actual lab on this, but you'll hold it very gently in your hand. You don't want to grip it real hard. You just kind of let it float there in your hand, and you're just going to gently roll it down, covering a specific dermatome on one side and then the other side. And you're going to say, do you feel a difference? So one side could feel sharper and one side could feel more dull. So which one has the problem? Good question, okay? Because it could be that they're hypersensitive on one side because they have an injury on that side, or it could be that the sensation is dulled on the opposite side because there's an injury on that side. So you have to correlate it with their historical, whatever you've taken in their history and what symptoms they're having. As far as myotomes, I'm not going to focus a ton on these, but I just want you to be familiar with them. The myotome is a muscle unit that responds to a particular nerve. So we're going to go through these starting in the arm. So when I do a muscle test, and I think I've mentioned this to you guys before, don't tell them to pull their arm up. Tell them to resist your force. That way, if you're a teeny little thing and you're working with a big old football player, he's not going to throw you across the room, right? So usually I'll put them in the position. I'll say, okay, we're going to flex your elbow like this, and then don't let me extend it. So they're just going to resist the force that you apply. So for the biceps, that's going to be your C5-6 nerve root. For the triceps, just the opposite. You're going to have them flex their elbow and then resist you trying to flex it more. So they're going to be using the triceps, and that's C6, 7, 8. Grip strength, you'll just let them grip your second and third fingers. Tell them to squeeze them as hard as they can. You shouldn't be able to pull your fingers out, okay? And that's testing C7, 8, and T1. Finger abduction, this one's a little tricky. Obviously, you're going to be able to overpower them. It's just the way it is. But you want to have them spread their fingers out and then hold that position while you try and force it together. And what you're looking for is that you feel some resistance there, and that's an adequate test for C8, T1. Opposition, you're going to put the thumb and a finger together and try to pull them apart. And again, you will be able to overpower them, but just if you feel resistance from them, then that's an adequate test, okay? Now going down to the lower extremity, and you can see in the picture here for your iliopsoas, which is one of your hip flexors, have them sit on the table and just lift their thigh off the table and hold it while you try and push it back down. Adductors, you're just going to put your hands between their knees and try to pull their knees apart and tell them to prevent you from doing that. Abductors, just the opposite. Put your hands on the outside of the knees and push inward, okay? And these are checking, as you can see, multiple levels. So for me, not as huge of a deal to go, oh, well, it's for sure L4, because you don't know. You have to correlate it with the dermatome and the deep tendon reflex that we're going to do. So just kind of know, okay, if there's an issue with this, then we need to check further. Hip extension, this is a tricky one for people because a lot of people have a gluteus maximus issue where they can't extend the leg very effectively. So you're going to have them prone, you're going to have them just slightly raise their leg and then hold it up, and you try to push it down. A lot of people have trouble with this, so just understand that it may not be a nervous problem, it may be a muscle weakness problem. Okay, and then we're going to do knee extension, which is for the quadriceps, and you can see these are great pictures for you to be able to see, but you'll say, okay, don't let me push your leg in, right? Because you want them to resist by extending the leg. For knee flexion, just the opposite. You can actually do it, if you go back here, if you flip your hands around and you put your hand behind and you say, don't let me pull your leg out, you're also going to activate the quad, or the hamstring. You can also do it this way. Either way is fine. Just don't put their leg into too much flexion or they'll get a cramp in the hamstring. Dorsiflexion, I just have them raise their feet up. Don't let me push it down. And then plantar flexion, I'll say point your toe down and don't let me push it up. So pretty simple way to just real quick run through them, and I'll show you, you can do it very quickly and get a sense of what's going on. Okay, here's how we grade it, because you're thinking, okay, now what do I do with this information? If they can resist you totally normal, no problems, complete range of motion, full resistance, that's a 5. If you feel a bit of weakness, okay, some resistance going on, that's a 4. If they can only hold the position against gravity, but as soon as you put resistance on it, they lose it, that would be a 3. If they can do the motion with gravity omitted, so you sort of change their position and they can do that, that would be a 2. If there's a little bit of contraction, that would be a 1. And if there's no contraction at all, it would be a 0. All right, third type of testing, deep tendon reflex. We have a lot of reflexes in the body. Some of them are very strange. These are probably the most common ones that you're aware of, okay? We have deep tendon reflexes, we have superficial reflexes, like in your eye. If something's coming to your eye, it'll automatically close. And then there's pathologic reflexes that we can do that will actually tell us something is wrong. Like there's one you can do in a baby on the bottom of their foot where if their toes go a certain direction, it means something's really going on. So there's a lot of reflexes built into the body. But let's talk about the deep tendon reflex. Basically what's happening is you're hitting the tendon with a little hammer like this. This is a nice one. We have the kind of triangular hammers, but same concept. So what you're doing is you're quickly stretching that tendon. And what the tendon realizes is, oh gosh, something's happening. So it will involuntarily contract to protect the muscle from being torn or injured. Okay, that's just a reflex that's built in. So we utilize that to make sure that that spinal level is functioning properly. Okay, so that's basically what this is saying. The muscle spindle in the muscle is sensitive to a change in length. So when you stretch it, it sends an impulse to the brain that the muscle is being stretched, and the brain will reflexively contract the muscle, okay? And if you want to get into it, you can kind of see the afferent efferent fibers, so coming in and out, and how it's communicating with the muscle through that neuromuscular junction. All right, so in the arm we have 3, and in the leg we have 3 DTRs. So this one, the arm ones are a little tricky, I'll warn you, but we'll give them a shot with you guys. But you're going to partially flex the elbow. I like to use my thumb of my other hand to kind of traction up on the tendon, and then you're going to hit right on your thumb. So it doesn't feel awesome. So you want to make sure you do it right kind of the first couple times, because otherwise you're just hitting your thumb. But what should happen is you should get an involuntary flexion of the elbow. Now, if any of you have had this experience, not everyone has crazy obvious reflexes. So don't get discouraged if you don't see something. You could also feel a twitch in the muscle, or the person may just have really low level reflexes that are difficult to get, and we have to do things to distract them. So we'll go over that. But this one, what you're hoping to see is you're hoping to see the little tendon of the bicep kind of pop out. This will contract, the arm will come up. That's what you want. For C6, the brachioradialis, you can use the flat side, and you're actually going to hit right on their arm. So you'll have them turn their arm with kind of the thumb up, and you're just going to tap them on the arm there. And what should happen is you should get a flexion and supination of the forearm. And it's a pretty cool one if you get it. This one's probably the easiest arm one, I would say. So again, you're just going to strike about 2 inches above the wrist there. And that's for C6, which again goes, if you're in anatomical position, right, it's on the lateral side, or if you make that OK sign, that's your C6 nerve. For C7, the triceps, this one can be a little tough, but it's also, it's possible to do. So you're going to hold their arm just like this, abduct to 90 degrees, you hold it up so they're totally relaxed. You're going to tap right there at that tricep tendon, okay? What you should see is this guy jumping out on you. So when you get it good, you'll see it, and then the arm will kick out. It'll extend involuntarily. If you're having trouble with this, what you can do is the hand that's holding the arm, you can throw your thumb up here, traction that tendon up a little bit, flip the hammer over, and then hit it with the small part of the hammer right onto your thumb. Sometimes that'll help isolate it. Again, it depends on the person. So obviously try it the easy way first. If it doesn't work, then you can make that alteration. For the patellar tendon, this is the one everybody knows. Oh yeah, my doctor's done that to me a million times. Fairly easy. Okay, you don't have to whack the person to death, but you're just going to tap that tendon just below the patella. So here's the bottom of the patella right there. So the tendon is basically between here and here. So you want to get right in the middle of it and just give it a good tap. Okay, and what should happen is their leg should kick out. Now again, if they're expecting it, sometimes it doesn't work as well. You may have to distract them. I'll show you a couple ways to do that by having them, twiddle their thumbs or close their eyes or bite their tongue or whatever, something that will help distract them so that the body can do what it wants to do. This one is very hard. That's why there's not even a picture. I will show it to you, but to be honest, I've only gotten it to work on like 3 or 4 people in my life. So it's on the medial side behind the knee. You're going to traction up with one finger and you're going to tap right on that fingernail of that finger and you should get a reflexive flexion of the knee. But again, pretty tricky. A lot of people don't even do this one, but I just want you to know it is there. Achilles tendon is very easy to get. You just have the leg hanging off the table just like this. You're going to tap at the back of that foot right on the Achilles tendon, and what should happen is they should plantar flex their ankle like they're pushing down on a pedal. So this one's, like I said, pretty easy. Just give it a good tap there and that will get that going. Okay, and we're going to stop here for this one.